Namaskar दोस्तों, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks Thursdays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 774वां 774th एपिसोड है. Let's have the headlines for today. हर जगह बीमारियां ही बीमारियां and researchers have reported differences in brains of boys and girls with binge eating disorder. तो बिंज ईटिंग डिसऑर्डर क्या होता है? इसमें जब भूख लगती है और इतनी भूख लगती है कि आप खाना ही खाते जाते हैं और ये बिंजेस में आता है, एपिसोड्स में आता है. तो ये इट इज पॉसिबल दैट इट इज अ साइकोलॉजिकल डिसऑर्डर और मे बी अ ब्रेन डेवलपमेंटल डिसऑर्डर. A study on vaccine hesitancy has revealed that vaccine hesitancy can lead to geo-clustering of epidemics. तो यदि कोई जगह है, कोई इलाका है जहाँ पे लोग वैक्सीन नहीं लगवा रहे, वहाँ पे एपिडेमिक ज़्यादा होगा, चाहे जिस मर्जी बीमारी का हो. And such a thing seems to have happened in Mumbai, where the cases of measles have begun rising suddenly. So the center has sent a team to control the rise in measles vaccines in Mumbai city. The US reports nearly 30,000 weekly child COVID cases. तो COVID वहाँ भी अभी बढ़ता जा रहा है और बच्चों में भी है. So we have to be careful. But unfortunately, in our part of the world, nearly 50 million doses, 50 million, 5 crore doses of Bharat Biotech's COVID-19 vaccine, Covaxin, are lying with the firm. They are set to expire next year because there are no takers due to poor demand. That's what the company has said. तो यदि आपका टीकाकरण, आपका इम्यूनाइजेशन पूरा नहीं हुआ कोविड का, तो प्लीज उसे पूरा जरूर करें. लेट्स गो टू आवर टॉपिक फॉर टुडे, अ वेरी यंग एंड यूथफुल टॉपिक. So hormonal health in adolescence. So we'll find out today about adolescence. Adolescence क्या होता है? And also we'll talk about the hormonal aspects of health and disease in adolescence. And for this, we have a special guest. He has been with us before. Warm welcome, Professor Jubin.
Thank you. Namaste. And thank you very much.
Namaskar. Professor Jubin Jacob is Professor and Head of the Department of Endocrinology at the prestigious Christian Medical College in Ludhiana, Punjab. His MBBS and MD is from Punjab and DNB from the National Board of Examination in 2007. He provides diagnostic and therapeutic interventions for all hormone-related diseases. And he's active not only in clinical care but also in research and education. And you will find, आप देखेंगे कि डॉक्टर साहब का जो डंका है वो अकेले इंडिया में नहीं पर दूर दराज की देशों में भी बचता है. तो in all the nearby countries and the far off countries like Scotland, like Bangladesh, Dr. Saab is a very sought after teacher. So Dr. Jubin, warm welcome. Lots of people greeting you today. You've met many of them before on KK Med Talks. Dr.
Yes.
Enes Sharda sir, our senior teacher who blesses us all the time. Swapna Jain ji from Vellore, Tamil Nadu, which is your alma mater as well. Dr. Vipin Bandula and Dr. Rameshpal Singh Pawar both are pediatricians. So we welcome their insights also in today's topic. Alankrit Sinha ji, Dr. Sanjeev Puri from Hoshiarpur, which is right next to Ludhiana, almost बाजू में है. Bombay style के हिसाब से बाजू में ही है. Vedant Kulkarni ji and Dr. Pradeep Rawal is from Ujjain in Madhya Pradesh. That is the center of India these days. So our topic is hormonal health in adolescence. So let's dissect this. एक एक करके इसको समझते हैं. Let's sort of wrap our hands around it. तो adolescence क्या होता है, डॉक्टर साहब? What is adolescence?
I mean, my understanding of adolescence ये है कि ये एक this is a time period between childhood and adulthood. अगर मैं इसकी correct definition मानूं तो WHO जो हमें देती है 10 और 19 साल के बीच में हम उसको adolescence मानते हैं. So ये I mean काफी different areas में काफी different definitions है, but I think most well accepted WHO की definition है कि 10 से लेके 19 years, 10 के नीचे हम चाइल्डहुड कहते हैं, 19 के ऊपर अडल्टहुड कहते हैं. तो ये इसकी एक बीच वाली जो हमारे डेवलपमेंट की एज ग्रुप एज है. I hope my Hindi is fine.
किशोर, yeah. तो किशोर अवस्था is would be the Hindi equivalent. And what Dr. Saab is saying is right. It's the phase between childhood and adulthood. तो बच्चा बड़ा भी हो गया है पर पूरा बड़ा नहीं हुआ मगर छोटा भी नहीं है. And that is a very in between kind of a phase of life. There's this wonderful story by Hans Christian Andersen, and that is the ugly duckling. Does that ring a bell, Dr. Jubin? And would you like to
Yes,
explain
I
it
do
to
remember
our
the story.
colleagues? Yeah.
एंड नाउ माय मेमोरी में नॉट बी ऑल दैट गुड, बट व्हाट आई जो मेरे को याद ये है कि ये जो दिस डकलिंग वाज द अगलीस्ट ऑफ हिज सिबलिंग्स. And I mean, he was not paid attention, or he felt that he was ugly and not paid attention. But then they realized that this was a family of ducks, and he was not really a duckling, he was a swan, he was a baby swan. And then when he reached adolescence and he uh, became an adult, वो एक completely changed. From an ugly duckling he became a very beautiful swan, and that's what I mean. There's a whole change. Same thing that we see with butterflies, with caterpillars.
Hmm. And this ugly duckling
So I
story
hope.
reminds us. Yeah, it reminds us actually that adolescence is a time where, किसी के हाथ कहीं जा रहे हैं, किसी के पैर कहीं, and some of the children who are growing up, they may feel that they are ugly ducklings, physically, socially, psychologically. But जब adolescence खत्म हो जाती है, then they grow up into very beautiful boys and girls, beautiful men and women. So it's a nice phase actually. It's a wonderful phase. Uh, we also have Ali Nazakat ji जो आपको good evening कर रहे हैं. अंशु सिंह जी भी logged in हैं, and Seema madam from Kolkata has logged in. She is also a health advocate. So we know what adolescence is. किशोर अवस्था हमें idea हो गया. ये भी पता चल गया कि ये ugly duckling वाला phase भी होता है कभी कभार. तो what are the common health issues that you see in adolescence? General health issues.
So I think this is a period where there is, number one, a lot of growth. There is a lot of growth which is projected into this area. A lot of centimeters are gained by both boys and girls. तो ये ग्रोथ में अगर कोई भी बीमारी आए तो ये ग्रोथ में इंटरफेरेंस हो सकती है. दूसरी चीज जो इस एज में होती है वो है, हम सब जानते हैं, प्यूबर्टल मेच्योरेशन और जो सेक्सुअल डेवलपमेंट और रिप्रोडक्टिव डेवलपमेंट होता है. और ये भी इंटरफेयर हो सकती है अगर कोई बीमारी इन दौरान इसमें आए तो. आई थिंक पर इन सबसे ज़्यादा इम्पोर्टेंट होती है जो मेंटल डेवलपमेंट होती है, जिसको हम कहते हैं कॉग्निटिव डेवलपमेंट, जो एक तरीका होता है जो चाइल्डहुड में आप कंप्लीटली डिपेंडेंट हो, और इंडिपेंडेंस आने के लिए जो कॉग्निटिव डेवलपमेंट होता है वो भी आई थिंक बहुत ही इंपॉर्टेंट पार्ट है एज एडोलेसेंट डेवलपमेंट. यूजुअली एडोलेसेंस जो होती है एक जनरली हेल्दी चीज होती है. दैट मीन्स जो क्रॉनिक बीमारियां होती हैं एडोलेसेंस में कम होती है, और इवन इलनेसेस चाइल्डहुड में ज़्यादा होती है, एडोलेसेंस में थोड़ी कम होती है. पर आई थिंक ये जो तीन चीज़ें जब आती हैं तो आई थिंक एक तो ग्रोथ की प्रॉब्लम्स दिखाई देती है, हार्मोनल प्यूबर्टल प्रॉब्लम्स दिखाई देती है, और आई थिंक मोर इम्पॉर्टेंटली ये कॉग्निशन में जब बाधा आती है तो साइकोलॉजिकल प्रॉब्लम्स, डिप्रेशन, एंग्जाइटी, ये सब बच्चों में नहीं होती है. ये सडनली एडोलेसेंस के टाइम पे आती है. डिप्रेशन, एंग्जाइटी, ईटिंग डिसऑर्डर्स, ये सब जो साइकोलॉजिकल इश्यूज होते हैं काफी ज्यादा जो है इन दौरान फर्स्ट टाइम एग्जिबिट होने शुरू होते हैं.
So biomedical and psychosocial issues both, and you can take it as an obstacle towards good health. You can take it as a hurdle which you have to cross to ensure good health. But you can also take it as an opportunity, as a window of improving health, overall health. So multiple questions are in Dr. Jubin, and one question comes from Dr. N.S. Sharda sir. He says. Earlier, menstruation used to occur in girls above the age of 10 or 11, and now that age is coming down. So, why is that?
आई थिंक इस एक चीज समझने की बात है कि जो हमारी रिप्रोडक्टिव हार्मोन्स हैं दे आर ऑल वेल डेवलप्ड. जब हम जन्म होते हैं दिस इज अ सिस्टम जो ऑलरेडी कंप्लीटली परफेक्टली डेवलप्ड है, बट दिस इज अ सिस्टम विच इज केप्ट अंडर चेक. तो हम 10, 12, 11, 13 साल इसको चेक में रखते हैं, और इसको चेक में रखने की जो जो इसकी जो सप्रेशन है वो जो हमारी ब्रेन में हाइपोथैलेमस है, ये पिट्यूटरी पे सप्रेस करके रखती है. वो सप्रेशन जो हटाने की मेन जो ट्रिगर होती है वो न्यूट्रिशन है. तो यानी कि जब बॉडी को लगेगा कि उसकी फैट स्टोर्स वेल डेवलप्ड हैं और न्यूट्रिशन एडिक्वेट है, तो वो ये सप्रेशन विड्रॉ कर लेती है, और उसके साथ फिर ये प्यूबर्टल प्रोसेस स्टार्ट होती है. तो आई थिंक फेयरली जो सबसे इम्पोर्टेंट रीजन जो है जो प्यूबर्टी अर्ली हो रही है उसका आई थिंक यही है कि हमारी ओवरऑल न्यूट्रिशन इम्प्रूव हुई है. न्यूट्रिशन इम्प्रूव होने के साथ साथ कुछ मैल एडजस्टमेंट भी आई है हमारे बच्चों में. अब ओवर न्यूट्रिशन ज़्यादा कॉमन है, विच इज़ ऑल्सो एक टाइप की मैल न्यूट्रिशन आप कह सकते हैं। हमारे बच्चे आर ओवर वेट, सम ऑफ देम आर इवन ओबीस। तो दीज पुश द प्यूबर्टी टूवर्ड्स एन अर्लियर डेट। और अदर चीज़ें जो हो सकती है, जो एनवायरमेंटल डिसरप्टर्स हैं हमारे, हम इतने सारे प्लास्टिक्स यूज़ करते हैं, ऑल काइंड्स ऑफ केमिकल्स, सॉल्वेंट्स यूज़ करते हैं, क्रीम्स यूज़ करते हैं, क्लीनिंग प्रोडक्ट्स यूज़ करते हैं। इनमें सब केमिकल्स हो सकते हैं जो हमारे जो डिसरप्टर्स कहते हैं, जो हार्मोनल सिस्टम्स को डिसरप्ट कर सकती हैं। आई थिंक ये 2-3 कारण है जो मैं सोचता हूँ कि अर्ली प्यूबर्टी, आई थिंक, पर प्राइमरी कारण तो ओवर न्यूट्रिशन ही है।
So, two reasons which Dr. Jubin is sharing with us. The first is body weight. तो अगर हम देखें इंडियन रेफरेंस मैन या इंडियन रेफरेंस वुमन का वेट कितना है, वो पिछले 20 साल में 10-10 किलो बढ़ गया है. सो द एवरेज वेट हैज गॉन अप. एंड जब हम स्टूडेंट थे, वी लास्ट डॉक्टर जेकब टू टेल अस द लेटेस्ट डेटा. जब मैं स्टूडेंट था तो ये पढ़ाया जाता था कि द ट्रिगर फॉर मेंस्ट्रुएशन इज नॉट एज, इट इज एक्चुअली वेट. And some books would say 35 kg, the other books would say 39 kg, which means कि जैसे ही बिटिया हमारी कोई भी 35 या 39 किलो से ज्यादा हो, more than 35 or 39, let's take a cut over 40 kg, जैसे ही वो वेट क्रॉस करती है, that means the body is ready and ripe for menstruation. तो आपके हाइपोथैलेमस से, आपके ब्रेन से ऐसा ट्रिगर आएगा जो पीरियड्स शुरू कर देगा. But the trigger is based upon weight, not upon age. So, Dr. Jubin, does that data still hold true, 35 or 39 kg, which we used to have 2.5 decades ago, or has it changed?
I'm not too sure about this, but what I recently was looking at some data from Delhi about puberty in school children. I think there they have found this to be almost true, still continues to be similar to what was talked about before that as well.
So a rough ballpark figure would be 35 to 40 kg, and obesity is a trigger. दूसरी जो डॉक्टर साहब ने बात की, he has to use the word environmental disruptor chemicals, EDCs. तो इतने सारे chemicals हैं, P for plastic, P for paint, P for pollutant, P for phone also, telephone, and all the psychological and auditory pollution that it does in your mind. And all these also lead to disruption of endocrine hormones. And one of the impacts is seen in endocrine disease and also in endocrine physiology. तो डॉक्टर शारदा ये भी पॉइंट रेज करते हैं कि पहले नॉर्मल मेंसेस होती थी 10 इयर्स से पहले, तो प्रिकॉशियस प्यूबर्टी वी वुड डायग्नोज एट द एज ऑफ 8 or below. But has that definition also changed? When do you diagnose early puberty or precocious puberty in a girl?
Yeah, so if a girl shows any sign of puberty, not just menstrual cycle, if it is less than 7 or 6 years, we would definitely be worried. But I think because we have seen कि अब बच्चे are having early puberty, we will not be worried about if a 9-year-old girl shows sign of puberty, because and I think it's primarily our concern will be if the child cannot handle the situation. If the child is able to handle the situation, I think the natural process, we don't interfere with the natural process.
जो अभी डॉक्टर जुबिन ने कहा, if the girl is not able to handle the situation. So let's talk about what disease is. Disease can be biomedical, it can be psychosocial. तो अगर बिटिया को किसी को पीरियड्स जल्दी आ रहे हैं, why are we worried? एक तो ये है रैपिड स्पीड, शुरू में वजन और लंबाई बहुत तेजी से बढ़ेगी, पर लंबाई अटक भी जाएगी. सो वी आर वरीड कि फाइनल एडल्ट हाइट ठीक होगी कि नहीं होगी. दूसरा, साइकोलॉजिकल इश्यूज. Suddenly periods आ गए, the girl is not prepared, none of her classmates or friends have had periods, and she might think she has a disease. So the psychological impact on that young brain is something that you want to avoid. And then the third thing is social. तो दुनिया भी खराब है, so we want our child to be safe. So these are the multiple things that you have to keep in mind, and your doctor will treat accordingly. They will ask you, the endocrinologist will ask you about this, the biomedical issues that you are worried about, the psychological, the social issues, and they will have proper treatment. But Dr. Jacob, supposing we want to prevent periods, a girl is 7 or 8 or 9, and the mother says, my daughter is physically not ready, or she's psychologically not ready, or society is not ready. So are there any injections that we can give which can postpone puberty?
Yes. Yes, so we can use injections. We have injections which shut down the pituitary. The pituitary is the master gland from where ये जो hormones बनते हैं that lead to puberty is all produced from the pituitary. So we can use injections which can temporarily shut down. This is not a permanent shutdown. It just temporarily shuts down, and we can shut it down for as long as we want. So we have injections which work for a month. We have injections which work for 3 months. And suppose we want to shut it down for a year, we can give about 4 of those injections and then stop it. If we want to shut it down for 2 years, we can give 8 of those injections. So I think we have the tools to shut down this whole process. And anytime we want to restart it, we just need to stop giving the injections.
They are just puberty postponers. They are not blockers or cancelers, and they are not irreversible. They are reversible. Though the last couple of patients whom I have seen in my OPD, I have become very good friends with the girls. हमारी पक्की दोस्ती, and we do high five and high 10. But sometimes the mothers are very apprehensive. So I would like to take this opportunity to tell them कि आप टेंशन ना लें. जैसे डॉक्टर जुबिन बोल रहे हैं, दवाइयाँ बहुत सेफ हैं. शुरू करनी है क्योंकि हम पीरियड्स लेट करना चाहते हैं, और जब भी आप मूड बदलोगे, जस्ट टेल अस 3 months बिफोर एंड वील स्टॉप द ड्रग. 3 महीने में एक टीका ही तो लग रहा है, एंड पीरियड्स फिर आने शुरू हो जाएंगे. Continuing with girls' health, we'll request Dr. Anis Sharda sir that we'll talk about boys' health in a few minutes. Continuing with girls' health, Seema ji पूछती हैं, all the teenagers now complain of cramps during periods, and nobody says that periods are comfortable. So why is this? Is this a modern development, or has it been there forever and ever?
I think pains with period is something that is there. I mean, if you ask about Adam and Eve,
I was
Eve
about to
was
say that. What is the Bible say?
so Eve was told by God that she will go through this process. I think this is part of the original sin, as that's what we believe from scriptures. So I think it is there right from the beginning, and it is usually worse in the earlier parts of once you start
Right.
having your menstrual cycle, especially in adolescence, early adulthood, and then subsequently it gets better and better. So I think period pain, or what we call menorrhagia, is again very, very common. And some kids, it can be completely unbearable. And there are countries which give you menstrual leave because it's so unbearable that you may not be able to go to school or function very well. But in India, we don't get that. But I think it's easily treatable with simple painkillers, and most of the time we can give relief. But there is nothing to cure it. It's just a normal process, and some people have a higher threshold for pain, so they never complain. Some people complain, and some people have physically more pain.
So in the Bible, actually, there is this story that Eve came out of Adam, and she came out of the left side of the rib cage. So that is the origin of sin, and that is why that is how they were able to explain, maybe in older times, why ladies or girls have periods and why there is pain during childbirth. That is also why in Latin language, left is sinister, and the left side is considered bad or evil. So, in the Bible, it's also written that all those who are in sin come to my left, and then you will reach hell. And all those who are healthy, or who are happy, or who have been good, who have not incurred any sin, come to my right, and you will reach heaven. So right is considered righteous, and left is considered sinister. But that apart, actually, I think cramps would have been there forever and ever, ever since Eve came on earth. But maybe earlier people were not listening, so that is why the girls were not complaining. And now things are better, we are listening. So it can be physiological or normal. It can also be a disease like endometriosis. So we should show a gynecologist. An ultrasound should be done. And there are medications that you can use to help reduce cramps. So they should be given to girls. Even simple things in diet, like maybe reducing salt, stopping Coca-Cola, tea, these kind of things in the premenstrual period, they also help. So another question coming again for girls' health. This is from Dr. Pawar. 12-year-old girl, weight is 30 kg. Okay, so she's not reached that 35 or 39 kg. No menses until now. Her birth weight was 1.6 grams only. So at 12 years, no periods. That is primary amenorrhea. Should we investigate or not?
Again, at 12 years, I'd be more interested to know whether she has any signs of puberty at all. I would expect that some signs of puberty have started, and we are just waiting for menarche to start. That is the actual physical manifestation of puberty. But I'm sure at 12 years she is underweight. I mean, I'm not sure what her height is, but she looks that she's slightly the weight is on the lower side. I think we can still wait. And if she has no signs of puberty, I think in the next 1 year, then she should see an endocrinologist.
Sir, other things we can do is बिटिया का कोई एग्जामिन करके they can look for breast size कि develop हो रहा है कि नहीं, and pubic hair. That is one thing. If it is present, then we relax. Another thing you can do is you can get an X-ray done of the left hand and wrist for bone age. यदि bone age 10 years से कम आ रही है, it means कि वाकई डिले है, तो फिर टेस्ट अभी करवा लेंगे. यदि bone age 12 years की आ रही है, तो फिर and height भी ठीक है बिटिया की, then we can relax maybe. So these are other things also to look at. Also, we will look for, and Dr. Bandula has also pointed that out, improve nutrition. So I was just about to say, we will look for evidence of macronutrient and also micronutrient malnutrition. And maybe grandfathers are doting grandfathers, तो उनको तो लगेगा कि बिटिया खाना नहीं खा रही और खाओ और खाओ. So maybe a neutral observer can just look for that, and that will help us decide what is to be done. कम से कम पहले
Yeah,
तो देख लेंगे.
at least in Punjab, if she's underweight, I would definitely check for celiac disease. So that is
Celiac
one very
disease.
common thing that we see here.
Yeah. And sometimes celiac will not present with any florid symptoms. It's just delayed puberty, delayed height, and the bone age will be delayed also in celiac disease. That is the only endocrine disease where you will get a delay in bone age. और चीज़ें भी कई बार आती हैं in terms of things that you have to rule out if puberty is delayed. But I think right now just an analysis of nutrition and also maybe an X-ray for bone age should do. Dr. Vipin points out that menorrhagia can occur during puberty, and that can lead to iron deficiency as well. So you can have spasmodic dysmenorrhea. The commonest would be puberty dysmenorrhea, क्योंकि जो system है hypothalamus, pituitary और ovaries का, it is taking time to mature, तो time लगेगा थोड़ा सा. Anshu Singh ji says that you can use home remedies like hot milk with jaggery, which is a good source of protein and iron as well, to reduce the pain during periods. And Dr. Vipin points out that we need the mother's history as well. What age did the mother experience menarche? That will tell us when the daughter is going to experience menarche. So more questions, sir. एक यासिक बेग जी मेरे को सवाल नहीं समझ आ रहा, तो कोर्सिंग मोंटो आई एम रियली नॉट श्योर, आवाज नहीं क्वेश्चन ही नहीं समझ आया, तो अगर आप एक बार दोबारा टाइप कर देंगे तो विल बी एबल टू फिगर आउट. डॉक्टर जुबिन, मोर क्वेश्चंस कमिंग ऑन अबाउट गर्ल्स हेल्थ. तो अलंकृत सिन्हा जी पूछते हैं, इफ पीरियड्स आर डिलेड बाय 4 to 5 days, so instead of 28 days you have a 33 days cycle, is that normal or is it abnormal in a teenage girl?
Yeah, so again, it depends on the what part of teenage life she is in. At least till 2 to 3 years after their first period, it would take time for ovulation to start properly. So I think irregular periods are you can ignore irregular periods in the first 2 years at least. 2 to 3 years you can ignore. But if it is persisting after that, you need to see whether there is any other problem. Especially we had the next question of PCOD. That is one of the commonest reasons why after puberty, 3 years, you still have irregular periods.
In this also, Lankrit, the definitions have changed. तो मैं जब स्टूडेंट था, नॉर्मल पीरियड्स की ड्यूरेशन या वो फ्रीक्वेंसी मानी जाती थी 21 to 35 days. तो अगर 21 दिन पे भी पीरियड आ रहे हैं रेगुलरली, दैट्स फाइन फॉर अ पर्टिकुलर लेडी, एंड किसी के 34-35 पे आ रहे हैं, दैट्स फाइन. But now when you look at the latest definitions from our colleagues in gynecology, some of them go up till 40 and 42 days also. तो अगर 42 days पे भी periods आ रहे हैं किसी को, regularly आ रहे हैं, so that is also normal. So the definitions also keep on changing. Sarabjit Kaurji says that you've talked of obesity and you've talked of endocrine disruptor chemicals. What about dairy foods? Eating more paneer, drinking more milk, is that associated with precocious puberty?
Directly, no. I mean, if all that is causing overnutrition, yes. And if all that is what we call, there is chemicals in there in that particular milk which may interfere, that may be one reason. But I think in itself, pure cow's milk is not going to cause any harm, not going to have any interference with our pituitary or gonads.
Yeah. Anamika Anuji also logged in, and so is Ratnesh Jain Sahab. Uh, Vipin Bandula ji says, adolescence is Jeevan ki Basant, the spring of life. A wonderful way of describing adolescence. And Dr. and Anshu Singh ji also reminds us, Kishore Avastha ya Kishore Kalin Avastha. That is the Hindi for adolescence. Seema ji would like to speak about polycystic ovary syndrome. So, Dr. Jubin, uh, polycystic ovary syndrome, let's focus on the following questions. Is it easy to label a girl or a woman as having PCOS? How often do we mislabel? And जब हम mislabel करते हैं तो where do we err? हम जरूरत से ज्यादा लेबल कर देते हैं या जरूरत से कम लेबल करते हैं इसको?
आई थिंक एक इम्पॉर्टेंट चीज है कि पॉलीसिस्टिक ओवरी डिजीज एक वेरी ब्रॉड टर्म है. सो उसकी सबसे फर्स्ट पार्ट ऑफ डेफिनेशन की ये है कि ये एक डिजीज ऑफ एक्सक्लूजन है. दैट मीन्स आपने बाकी सारे डिजीजेस एक्सक्लूड कर लिए तभी आप पॉलीसिस्टिक ओवरी डिजीज इसको कह सकते हो. इसमें सिंपल डिजीजेस लाइक हाइपोथायरॉयडिज्म या प्रोलैक्टिन बढ़ने वाला काफी डिजीजेस हो सकते हैं. मे बी जस्ट मैल न्यूट्रिशन जिसमें हाइपोथैलेमिक एमेनोरिया होता है या टू मच ऑफ एक्सरसाइज, स्ट्रेस, ये सब आपने एक्सक्लूड करने के बाद ही यू कैन एक्चुअली लेबल समबडी एज पॉलीसिस्टिक ओवरी डिजीज. सो इट्स अ very wide term, and the primary thing is it's if you cannot find any other reason for it, that is when we call it polycystic ovary disease. और अगेन पॉलीसिस्टिक ओवरी डिजीज की बहुत ही कॉम्प्लिकेटेड डेफिनेशंस हैं. देयर आर पीपल जो हमारे डेफिनेशंस है, आई थिंक 3 डिफरेंट टाइप्स ऑफ डेफिनेशंस हैं. एक जो हमारे फर्टिलिटी डॉक्टर्स ने बनाया है, सो दे आर फोकस्ड ऑन एनोवुलेशन, यानी कि जिसमें एग्स नहीं बन रहे हो और पीरियड्स लेट आ रहे हो. एक दूसरे तरफ है जो हमारे एंड्रोजन एक्सेस सोसाइटी है, दे आर फोकस्ड ऑन जो उसके मेल हार्मोन्स जो बनते हैं उसके एक्सेस के सिम्टम्स जो हैं, स्पेशली हेयर ग्रोथ, एक्ने, और ये सब सिम्टम्स पे वो ज़्यादा फोकस करते हैं. आई थिंक मिडिल पाथ इज प्रोबेबली द बेस्ट पाथ. और अगेन द मोस्ट इंपॉर्टेंट क्राइटेरिया इज कि अल्ट्रासाउंड में अगर आपको पॉलीसिस्टिक ओवरी डिजीज दिखे तो वो पॉलीसिस्टिक ओवरी डिजीज नहीं है. दैट मीन्स वो एक कॉम्पोनेंट है एंड इट इज नॉट एन एसेंशियल कॉम्पोनेंट दैट यू रिक्वायर कि अल्ट्रासाउंड में ये पॉलीसिस्टिक ओवरी डिजीज होना चाहिए. सो डेफिनेशंस अलग अलग हैं, बट जनरली इसकी जो मेन चीज यही है कि हमें एक तो पीरियड्स एनोवुलेशन के सिम्टम्स होने चाहिए या पीरियड्स जो हैं साल में 8 से कम होनी चाहिए, जिसे हम ओलिगोमेनोरिया कहते हैं. सेकेंड है कि हम इस पेशेंट में कोई एविडेंस देखें कि इसकी मेल हार्मोन्स की एक्सेस है. इधर हम क्लिनिकल एविडेंस देखें जो आपको दिखाई देगा अगर आप देखोगे कि इनके बॉडी में हेयर ग्रोथ ज़्यादा है. अगेन नेचुरली एज इंडियंस और एज साउथ एशियंस हमारी जो बॉडी हेयर ग्रोथ है वो नॉर्मल कोकेशियंस और ईस्ट एशियन से ज़्यादा ही रहती है. तो आई थिंक ये भी, आई थिंक इट हैज़ टू बी वेल डॉक्यूमेंटेड कि ये ज़्यादा है, और फिर हम हार्मोन्स टेस्ट करते हैं. और ईदर ऑफ दीज टू प्लस पॉलीसिस्टिक ओवरी डिजीज हमें जब अल्ट्रासाउंड में दिखती है तो देन वी कैन बी अ लिटिल मोर कॉन्फिडेंट. बट आई थिंक this is again a question that comes many times. You're looking at it एक तरीके से देख रहे हो. Gynecologists are looking at it from the menstrual angle, the dermatologists are looking at it from the acne hirsutism angle. So I think you need to have a better picture before we label somebody as polycystic ovary disease. And I think it is a simple lifestyle disease, and primary treatment is lifestyle changes only.
So multiple things coming up. एक तो डॉक्टर साहब ने कहा कि ध्यान से लेबल करें. एक तो ये क्योंकि वैसे ही इन मेनी एथनिक ग्रुप्स इन इंडिया बॉडी हेयर इज मोर एज कंपेयर टू कॉकेशियंस. इट डजंट मीन दैट वी आर सिक, इट जस्ट मीन्स दैट वी आर अ डिफरेंट काइंड ऑफ नॉर्मल. तो अपने एथनिक ग्रुप के हिसाब से देखें कि हेयर ग्रोथ ज्यादा है कि नहीं. दूसरा, रिगार्डिंग पीरियड्स, ऑलरेडी वी मेंशन्ड इट मे टेक अप टिल 2 years. सो दिस पॉइंट इज रेज्ड बाय सीमा जी एज वेल. इट कैन टेक अप टू 2 years फॉर दिस ब्रेन ओवरी एक्सेस टू गेट मैच्योर. तो अगर किसी लड़की को पीरियड्स रेगुलरली नहीं आ रहे फॉर द फर्स्ट 1 or 2 years आफ्टर मिनार्की मतलब जब पहला पीरियड आता है, तो एक ही इलाज है और बिटिया को बोलना है नॉट टू वरी. वील टॉक अबाउट व्हेन टू गेट अ थायराइड टेस्ट डन, अभी कुछ ही मिनट में बात करते हैं. तो एक तो यह कि हेयर ग्रोथ में भी डिफरेंट अमंग्स डिफरेंट पीपल. दूसरा, periods may not be regular for the first 2 or 3 years after menarche. एंड तीसरा जो हम अल्ट्रासाउंड करते हैं, डॉक्टर जुबिन, वुड यू लाइक टू स्पीक अबाउट द टाइप ऑफ अल्ट्रासाउंड दैट इज mentioned in the guidelines for diagnosis and the type of ultrasound that we would advise an unmarried Indian girl to undergo?
Yes, so I think जो fertility doctors हैं, they believe that it has to be a transvaginal ultrasound, which is not possible for unmarried girls or adolescent girls. So adolescent girls, we are doing an abdominal ultrasound. Now, abdominal ultrasound may not जो चीजें जो हमने अल्ट्रासाउंड में देखनी होती है, नंबर वन आप हमने स्मॉल स्मॉल फॉलिकल्स देखनी होती है और फॉलिकल्स की काउंट करनी होती है. दीज फॉलिकल्स में रेंज फ्रॉम 2 millimeters to 13, 14 millimeters. So some of the smaller follicles are extremely difficult to pick up when you do an ultrasound. So the other thing to look for is कि जो आपकी ओवरी की साइज बड़ी हुई है कि नहीं है. Now these are reversible changes. जो अगर आपने suppose somebody has polycystic ovary disease और उन्होंने lifestyle change की, ये मे बी 1 year के बाद ये चेंजेस रिवर्स भी हो जाते हैं टू सम एक्सटेंट. जो फॉलिकल काउंट है वो कम हो जाएगी और जो वेरिएंट साइज है वो थोड़ी कम दिखने लगेगी. सो आई थिंक ये जो अल्ट्रासाउंड मैं कहूँगा व्हेन आई गेट एन अल्ट्रासाउंड कि हम एक जो इस अल्ट्रासाउंड करने में इंटरेस्टेड हो फर्स्ट और इस पे थोड़ी सी ज़्यादा वो केयरफुली ये अल्ट्रासाउंड करके ओवेरियन साइज हमें बताते हैं, फॉलिकल काउंट करने की कोशिश करते हैं. और sometimes follicle count is very difficult on an abdominal ultrasound, and it's much easier on a transvaginal ultrasound, which is only possible when you're doing all these tests for fertility and other things, not possible in adolescent girls.
So all these points tell us ऐसा नहीं है कि PCOS नहीं होगा in adolescent girls, but more often than not we may end up overdiagnosing. So we should be careful and we should tell our girls कि ये lifestyle disorder disorder है, the way Dr. Jumin has mentioned. तो अगर lifestyle disorder है, so the treatment is lifestyle modification. So Dr. Saab, what are the common challenges that you face in your OPD when you talk to girls about lifestyle modification?
So I think
to their mothers as well, and to their mothers as well.
So I think the primary focus of lifestyle, again, we have to remember, लोग सोचते हैं कि PCO is always in overweight kids. It does not happen. It can happen in lean children also. Again, the primary focus is still lifestyle, even in lean kids. That means not normal weight kids or even underweight kids. It can happen even in underweight kids. So the primary focus is still lifestyle. In lifestyle, we are just, I mean, we are not giving them a special diet. We are telling them that they need to, they need to focus on the amount of calories they consume. If they are overweight, they need to cut down on calories. और जो कैलोरीज आते हैं वो जो मैक्रोन्यूट्रिएंट्स होते हैं, हमारे पास 3 मैक्रोन्यूट्रिएंट्स होते हैं, कार्बोहाइड्रेट्स, प्रोटीन्स और फैट्स. इसमें जो सबसे नोटोरियस जो कंपोनेंट है वो कार्बोहाइड्रेट्स है. सो वी हैव टू try and limit the amount of energy we are getting from carbohydrates. So I generally explain to about 50 to 60% of our total calories should come from carbohydrates. And then all the other things that I think I would explain to any other kid is healthy food, avoid junk food, avoid soft drinks, avoid fruit juices, eat more fruits and vegetables. I think these are exactly all the things that a child with PCOS also has to do. In addition, I think exercise is very important, and aerobic exercise, not just to lose weight, just the fact that 40-45 minutes or about 150 minutes of exercise is going to improve ovulation, is going to improve many other things with concern with polycystic ovary disease. And I think the focus, sometimes patients I see in my OPD getting they have absolutely normal periods, but they have not lost the weight that they expected to lose, and that puts them off. But I think you should focus on telling them that this exercise is not to lose weight. This exercise is to stay healthy and get regular periods. So that I think helps. But again, there are kids in college, for them all this, in staying in hostels, all this becomes very, very difficult.
It becomes tough, but you just have to keep on explaining. And sometimes what I've seen is कि आपने PCOS का लेबल लगाया तो that becomes an excuse for the girl and also for the family कि जी इसको तो जी polycystic ovary disease है, इसलिए ये मोटी है, इसलिए इसने कभी पतला ही नहीं होना लाइफ में. So that also we should guard against actually. अगर PCOS के लेबल लगा भी दिया किसी डॉक्टर ने, तो what that means is कि you work double hard, you work extra hard so that you can maintain your health. Vinny Joglekar ji is a nutritionist from Bangalore, and she adds some very relevant points. So she says that belly fat, that is central obesity, and overall fat also contributes to polycystic ovary, and sedentary lifestyle and refined foods can increase the risk. डॉक्टर एन एस शारदा सर ऑल्सो सेज कि ओवरवेट एंड पीसीओडी में पहले क्या आता है, तो सर के दो सवाल हैं. एंड सर आई अपोलोजाइज, वी हैव नॉट इवन कम टू द बॉयज येट, बट अब बॉयज की भी बात करते हैं अगले 10 मिनट. तो डज ओवरवेट कॉज पॉलिसिस्टिक ओवरी, और डज पॉलिसिस्टिक ओवरी कॉज ओवरवेट? दैट्स वन क्वेश्चन फ्रॉम सर. एंड द सेकंड इज, आर दीज क्यूरेबल?
Again, I think there is no answer to this question because किसी ने अभी तक पता नहीं किया. Because we can even get overweight, we can get polycystic ovary disease in lean children. We can even get it in underweight children. I have seen children with a BMI of 17 getting polycystic ovary disease. So I think the final, there is no, I'm sure there is no unifying diagnosis. Polycystic ovary disease is probably a manifestation of many diseases. Like we say, diabetes can be many types. So I think polycystic ovary disease is also probably not a single disease, is a manifestation of many diseases. In some, it's primarily the weight that is contributing to the insulin resistance, contributing to the anovulation, contributing. In some, it may be the androgen excess which is contributing to the insulin resistance. So there is no unified theory. I think the kids or the children with PCOD have a full spectrum, and I'm sure in future we may be able to separate out this is this and this person, this is the primary triggering factor. We may be able to do it in the future.
And curable तो है कि नहीं, but manageable जरूर है. So we just have to work a little bit extra on our lifestyle. More questions coming up, and Sinha साहब पूछते हैं कि students who prepare for competitive exams consume a lot of tea and coffee. Does intake of caffeine affect menstrual health?
I have not heard of a direct relationship, but definitely stress causes what we call hypothalamic amenorrhea. You mean directly stress will shut down the pituitary and in turn shut down the gonads for a small period of while. Again, caffeine can be an anorexic agent. So if you lose weight and because of stress you're losing weight, that can also cause what we call hypothalamic amenorrhea. So though डायरेक्ट तो मेरे को रिलेशन नहीं दिखता है, पर आई थिंक दीज टू वेज, कॉफी, एक्सेस कॉफी ड्रिंकिंग मे बी जस्ट अ मैनिफेस्टेशन ऑफ स्ट्रेस इटसेल्फ, and excess coffee drinking might lead to anorexia and less consumption of food and weight loss and malnutrition.
Though, Dr. Jubin, I finished all the coffee there was in my house and I still haven't lost even 1 gram of weight. That is separate matter. Seema ji पूछती हैं, would you like to share some tips? Young girls coming in with irregular periods, age 10, 12, 14, 16, in whom should I get a thyroid test done? On history, what are the personal and the family history features which would tell me कि बेटे अभी thyroid test करा के आओ, and which are the situations where I might say अच्छा बेटे अगली बार करा लेना, let's see next time. Thyroid test in adolescence for screening. When should we screen?
So I think a thyroid test is a very inexpensive test. At any period, we feel that, especially if you feel that the height and weight don't match, that is a trigger for doing a thyroid test. I think ruling out hypothyroidism is very important before you label anyone as PCOD. So that means if you have somebody who's had menarche 3 years later, they are still having irregular periods, I think getting a thyroid test is a good idea. Overweight children, getting a thyroid test is good idea. If any child complains, there are some symptoms which are very specific. Dry skin, I see dry skin with, or I see somebody with new onset constipation. I see someone, I mean, these are all triggers which will, I think, might trigger for getting a thyroid function test in a slightly overweight adolescent is very low because it's a very simple test and we can rule out with just a TSH whether this is, we are dealing with an untreated case of hypothyroidism. I think that is why I would get it. My trigger would be very low for getting a TSH done in an adolescent.
If there's a family history, if there's any cognitive dysfunction, बच्चे के पढ़ाई में नंबर नहीं ठीक आ रहे, now there can be a million causes for that, but rule out thyroid. So any cognitive dysfunction, any physical dysfunction in terms of weight gain, for example, and mother actually swears कि बच्चा कुछ भी नहीं खाता फिर भी weight बढ़ रहा है, so think thyroid. So these are some things you can do. Seema ji points out that pranayam helps a lot, and some yogasanas. Mandukasana works on central obesity. Tadasana helps in overall stretching and flexibility. And Surya Namaskar gives overall exercise of the body. Millets are good. They do have a lot of carbohydrates, but the carb to fiber ratio is less. So the fibers are more and therefore the glycemic index will be less. ये चीज हम ना इसमें भी देखते हैं आलू और शकरकंदी में. So you would think that potatoes have less calories and are not so bad for diabetes as compared to sweet potato. But it's the opposite. Sweet potato की 15 calories कम है per 100 grams and sweet potato का fiber 3 गुना ज्यादा है. और जिस तरह से हम शकरकंदी खाते हैं इंडिया में भून के या उबाल के, so we don't add ghee to it, we don't fry it, while potatoes will be fried quite often. So millets and शकरकंदी, they do have a role, but ऐसा नहीं कि एक एक किलो खिलाते रहो. One last question for girls, that is from Sarabjit Kaurji. Are anovulatory cycles painless? So what does anovulatory mean? And yes, they are painless. So if we understand what anovulatory means, then we'll know the answer.
So again, anovulatory, if you ask me scientifically, it means that this is a period where there is the endometrium has shed because of estrogen withdrawal, not because of ovulation. So that's an anovulatory cycle. Sometimes, if you're a fertility specialist, you would do lots of tests to determine whether you're getting an ovulation or not. But most of the time, whenever we see a period or a cycle length which is more than 35 days or a number of periods less than 8 in a year, we assume that this is an ovulatory cycle. We don't do any special tests to figure out whether there is an ovulation happening or not. When we say an ovulation, it's not that all cycles will be anovulatory. It will be some cycles will have ovulation, some cycles will not have ovulation. So that's how we tend to figure out whether patient is anovulatory or not.
Thanks. And Dr. NS Sharda sir says, जाते जाते लड़कों की भी बात करते जाओ please. So any
Yes,
comments
I
on
think.
adolescent health
I,
for boys?
yeah, so I think boys are generally ignored, and you will find very few boys actually coming because girls have triggers like period disturbances and things like that, hirsutism, where their parents might bring them. Adolescent boys are less likely to come to the hospital or come to an OPD or come to because they don't have any of these symptoms. But I think adolescent boys also need inputs. Many of the times they are overweight. They don't have the same consequences of being overweight. Immediate consequences of being overweight. But I think we tend to not give the same attention to health because they don't have those same expressions of those diseases. So we don't. But I think adolescent boys also need equal attention as adolescent girls.
We should be careful. And Sunny Groverji, he is logged in from Karnal, one of our industry leaders. He says that for young boys, you have to be very empathic and very sensitive because you don't know what kind of things they are going through at school. They may not come home and share. Girls may share more frequently. So if you feel your child is not growing as fast as other boys of his age group, do take a few minutes out to speak with him. Is there anything I can help you with? Do you want to show a doctor? And if a teenager comes to you if you're a doctor and teenager comes to you, then do ask a few questions. How can we help? What can we do? Anything troubling you at school? Any psychological, any social issues? And you will find good answers. You'll get good insight. What I have seen in my clinic is that there is an ethnic issue also. So there are some ethnic groups where the father will bring the boy at age 8 or 9. कि जी डॉक्टर साहब इसकी दाढ़ी मूछ नहीं आई, इसको लंबा करो. So there are groups like that. And there are other groups, they will wait happily until 18, 20, 21. So it doesn't matter. So, but only when the child crosses 21 and says, "Vi शादी करानी है, दाढ़ी मूछ नहीं आई, चलो जी डॉक्टर के पास चलते हैं." So that ethnic divide is something that I see quite starkly in Karnal. Do you see the same, Dr. Juven?
Yes, I
Ethnic
think
divide, yeah, in terms of healthcare
there are
seeking behavior.
there are mothers who are very concerned and they bring them early. They even they are worried about the size of the genitals and they bring them quite early. And then you see those 18 years, 20 years walking in with absolutely no signs of puberty, and they have come in for the first time.
Mhm. So maybe we need to follow the middle path here, and this is केके में टॉक्स का उद्देश्य भी यही है कि हम इसके बारे में जागरूकता फैलाएं। इसके बारे में मतलब जो आज का टॉपिक है, which is adolescent health, hormonal aspects of adolescent health. So सनी ग्रोवर जी पूछते हैं, would you recommend that every adolescent goes to an endocrinologist for a routine checkup?
I'm not sure whether he needs to come to an endocrinologist, but I think in adolescence, all children should be reviewed by a pediatrician at least annually or at least once in 6 months. This is not just for health, it is for immunization, every other aspect. I think adolescents should be considered as part of, when they're small, we routinely take them to a pediatrician, but once they are 12, 13, we stop taking them to a pediatrician. Even boys need to go to a pediatrician at least once in 6 months or 12 months, even if they have no illnesses, just to keep up with all the newer vaccines that are coming, make sure that the vaccination is up to date. And also, I think that gives an opportunity for pediatricians to see whether the child is having any psychological issues, he is keeping normal weight, the BMI is checked, he looks at whether the height and the weight are matching. So I think all these require, at least till the age of 18, 19, children, adolescents should be seen by a doctor every 6 to 12 months, even if they have no issues at all.
So that's an important point. किसी ना किसी डॉक्टर को जरूर दिखाएं, चाहे पीडियाट्रिशियन को, चाहे एडोलेसेंट पीडियाट्रिशियन को। काफी सारे पीडियाट्रिशियंस हैं who specialize in adolescent health now, चाहे किसी फिजिशियन या एंडोक्रिनोलॉजिस्ट को, but someone should show that continuity should not be broken, क्योंकि यही एक अपॉर्चुनिटी है जहां पे आप नींव रख रहे हैं फॉर फ्यूचर हेल्थ ऑफ द एडल्ट हु इज कमिंग अप, हु इज गोइंग टू हु इज गोइंग टू ब्लॉसम। जैसे वो अगली डकलिंग थी, जैसे वो स्वैन बन गई, तो हमारे बच्चे भी जो हैं वो स्वैन बन जाएंगे, हंस बन जाएंगे बहुत जल्दी। Dr. Jubin, it's been great having you. What I realize is that when you speak of young things, like you speak of children and adolescents, you yourself get energized. Do you get the same feeling speaking of young people and young hormones?
Yes, I think when I see them in the clinic, also I feel very happy, and and I think again, I worked in different countries, so it's not the same in different countries where you can relate to adolescents. But here in India, we can, at least I can relate to the kids who are going through adolescence, because I've gone through the same thing. And maybe 20 years before, but I think things are still the same. The parental stress, the stress of competitive exams, the stress of, this stress of looking good, or having muscles, or being thin, or being tall, being short. All these things are, I think, identical to 20 years back, not very different. Maybe technology is slightly different, but I think I can relate to them. And so I do feel very good when I see them in my OPDs.
I think that's true for all of us. We agree with you, Dr. Juban. मिश्रा जी राम राम जी कर रहे हैं, विनीत भाटिया गुड इवनिंग कर रहे हैं, अली नजाकत साहब कहते हैं कि एग्रेसिव बिहेवियर बहुत है। तो हाउ टू हैंडल, नजाकत साहब इफ यू अलाउ लेट अस टेक अ सेपरेट सेशन ऑन दिस, क्योंकि वाकई इंपॉर्टेंट है। हमारा पिछला जो सेशन था दैट वाज अबाउट स्टडी एंड स्ट्रेस, स्टडी एंड हेल्थ, एंड जो मैडम थी शी वाज डॉक्टर प्रीतिमा वर्मा, हाल ही में 3 दिन पहले, एंड शी वाज अ कंसल्टेंट साइकोलॉजिस्ट फ्रॉम देहरादून। सो कई बार एग्रेशन एंड स्टडी स्ट्रेस गो हैंड इन हैंड। सो आई वुड रिकमेंड के इस सोमवार वाला हम केके मेट टॉक देखें, एंड इसको अलग से भी लेते हैं, अग्रेसिव बिहेवियर इन एडोलसेंट्स, हाउ टू हैंडल इट। With this, it's been great being with everybody. Dr. Jubin, people from all across the country logged in. What final take home would you have for us? Our topic is hormonal health and adolescence.
So I think my final take home is that the ages between, let's say, 10 to 19 is an area. Most children may not have major health issues, but they may have many hidden health issues that may be picked up by a healthcare physician, which may not be picked up by the parents. So I think my take home message is adolescence is a period of time where we can intervene, and many times we can intervene early. So I think these children should be seen by a pediatrician or a physician or an endocrinologist, by someone on a regular basis through adolescence till they come into adulthood. I think that is the message that I'll give, because so many things are happening. Growth is happening, psychological issues are happening, puberty is happening. So somebody has to keep a check whether all this is happening in the right time, it is happening in the right way, and things are moving along as it should. I think parents may not be the best people to judge if everything is going in the right way. So I think keeping in touch with a healthcare professional may be the most important thing for these 8-9 years of adolescence.
तो continuity मेंटेन करके रखें ड्यूरिंग ट्रांजिशन फ्रॉम चाइल्डहुड टू अडल्टहुड। इसके साथ सबको शुक्रिया करेंगे एंड सबसे पहले शुक्रिया, थैंक यू, धन्यवाद डॉक्टर जुबिन का। सो प्रतीक, कुड वी शो अ सर्टिफिकेट ऑफ एप्रिसिएशन फॉर सर प्लीज? थैंक यू डॉक्टर जेकब वंस अगेन। इट्स बिन ग्रेट हैविंग यू ऑन द शो। जैसा कि आप सब जानते हैं, केके मेटॉक्स रोज आपकी सेवा में हाजिर होता है और मैं आपके साथ होता हूँ हर सोमवार और वीरवार। I have also, I'm on the wrong side of 50, Dr. Jubin, so I have begun mixing up Mondays and Thursdays. सोमवार और जुमेरात को मैंने मिक्सअप करना शुरू कर दिया, बट आज मैं ठीक हूँ, आज मैंने रट्टा लगाया हुआ है पूरा। सो आई नो दैट टुडे इज थर्सडे, आज वीरवार है और आज जुमेरात है, इसलिए अगली बार फिर आपको मिलूंगा मंडे को, सोमवार को। एंड हमारे साथ होंगे डॉक्टर कार्तिक बालाचंद्रन, जो कि बहुत डायनामिक एंडोक्रिनोलॉजिस्ट हैं फ्रॉम चेन्नई सिटी। And 14th तारीख happens to be World Diabetes Day as well. So we'll be speaking about, not about diabetes, we'll be speaking about other things as well, specific aspects. But तब तक आपसे इजाजत लेते हैं। आपको फिर मिलूंगा मैं सोमवार को। डॉक्टर जुबिन को भी थैंक यू करते हैं, धन्यवाद करते हैं और जय हिंद।